It's such a pleasure to welcome you all here today for the second Stanford Center for Digital Health Annual Symposium. It's our great responsibility to ensure that all human needs remain at the core of what we do.
Our goal is to enable our people to succeed, enable our people to do their very best, and to provide opportunities and incentives for our people to come together and collaborate and have impact. That's what makes a place like Stanford have a unique multiplier effect.
We were doing AI here at Stanford Healthcare before the Beatles were on the charts and bell bottoms were still in style. So we have a real opportunity to be able to bring technology to bear in unique ways in serving our communities.
You know, traditionally, healthcare has been a decade behind in technology, plus or minus. And with AI, I think we could argue that we're a year or two ahead of most other industries.
We're sort of coming out of that hype phase where it was going to fix everything and meeting the realities of where it's going to be fantastic and where we need to be a little bit more cautious.
I'm optimistic that AI is going to help us physicians, free us to be able to actually do what we are good at, which is interacting with patients by taking away some administrative tasks from healthcare.
Digital health will not only help individuals, but it can also help whole communities and populations at the same time.
Right now is a very unprecedented time when we think about the amount of focus on rural health. This is meant to be truly transformational work that will change the way that we deliver care to really unlock access.
Guess what? You should opt for nutrition, veggies and fruits, and stop eating junk food. And that just is not clickbait. Digital health for me is a whole new field of communicating health information. I'm a professor. My currency was usually writing a paper and sending it in and getting it published and going to a conference. But now there's social media, there's traditional media, and this idea of trying to communicate in an accessible way. This is really brand new, and the reach, the potential reach is much larger this way.
I'm excited about where this can go. AI is going to transform medicine, how it's delivered, and most importantly, I think, how the information that is provided is analyzed. And the implications for that, for the whole practice of medicine, are profound.
The frontiers are endless and are so exciting, and I'm delighted that Stanford is a leader in every aspect of the digital health revolution.